Hello again, John and Joan back for the last time this term uh, on our communication skills show. Today we wanted to discuss the video recording review tutorials. Um, this tutorial is in a slightly different format from some of the previous years, in that now we're doing all of the video reviews on the same session, a 2-hour session, um, rather than on individual or separate sessions. We believe that the session is going to be in the LRC. There have been some problems in previous years, so we've asked for an upgrade in the technology there to enable bigger screens and better audio equipment so that the videos can be seen and heard. Should there be major problems with that, then we will have to relocate the session to the tutorial rooms in the medical school. Please check before you turn up for these sessions just to make sure that you're in the right place. We will be making sure that everyone knows early. The session itself, you'll have 4 students. The student will have their own videotape on a USB. There will be a laptop which will also be connected to a larger screen in the room. And essentially the student is in charge of their own recording here. Joan.
Yeah, so the student essentially leads the discussion based on their own prepared self-assessment. So each learner should come with that form where they've critically analyzed their interview performance. So they've identified 3, communication strategies that were very effective and 3 that they would like to work on because they were not as effective. So they lead the discussion. And this is really an opportunity for peers and you as an expert in communication skills to offer your feedback to that learner. And learners learn from each other. So oftentimes when they aren't talking about a particular challenge, they can identify with it when one of their colleagues has identified it as well ahead of them. So each learner then comes prepared to lead their own discussion. You will receive all 4 assessments from your learners, and during the taping, when you're going to be watching that full interview, we would ask you to review the learners' comments, their self-assessment. And you are going to be asked to consider whether this assessment is satisfactory or unsatisfactory.
Now, it's important, Joan, here to say we're not assessing the quality of the interview.
That's right.
We're looking at the self-assessment. So, an absolutely dreadful interview. Mm-hmm. If the students sort of said it was a dreadful interview, and here's why it was so dreadful, and maybe, well, not maybe, hopefully, here's some things that I actually did well, I thought, despite the rest of the interview being poor. That's great. That's what we want. If they have a wonderful interview, but they can't identify the things that were positive about it, the areas that they may not have done so well, then that's not satisfactory. They need to be able to say, well, this was because of these reasons this was good, and here are some of the poorer areas. Yeah. So it's, can they self-assess? Is the self-assessment accurate and appropriate? Not, was the underlying interview good?
That's right. And students may need to be reassured of that right up front. We know that learners who can assess their deficiencies can work on them and improve. Learners who don't see themselves as having deficiencies don't improve. So really that's the whole foundation of this kind of work. And to be able to learn from each other, which is why students are doing these DVD reviews with you, with their peers.
The tutors are expected to sign the student assessment form, and the students have that in their own learning portfolio. The student should give that to the tutor. The tutor is expected to sign the appropriate page, and you're asked to mark whether it's satisfactory or unsatisfactory. If it's satisfactory, that's all we need to do. If it's unsatisfactory, the student gets a second chance because they've got a second video that they can then go and write an appropriate review on and bring it back to you to see and reassess. We'd also like to know if there are any unsatisfactory assessments done there. So if you could let us know either through undergrad or through Linda McNutt in the Communication Skills Programme, linda.mcnutt@dal.ca, that would be useful, just so we've identified the problem and make sure it's followed up and dealt with.
Yeah, and I think that most students do very well. Some of the pitfalls that, if you're discussing it with your learners ahead of time, is really looking at what is effective feedback, and that applies to self-assessed feedback as well. So the student who writes down a great empathy throughout the interview, that is not helpful feedback, it's not specific. So we would be looking for, why would a learner say that? Where was the empathetic response effective, and how was it effective? So again, so it needs to be not general, it does need to be accurate as well. And that is what the learner is going to be discussing and leading in the discussion. And that's what peers and yourself will be commenting on and adding to as well, so that there's more depth in the discussion.
Students will probably be quite upset looking at their own videos. No one likes looking at their own videos. Yeah. Believe us, we know. We've looked at these and it's a bit embarrassing. Mm-hmm. But they do appear to be working, so that's why we're continuing doing it. So they need some support in saying, yeah, don't worry about how you look and sound. Everyone feels anxious and upset when they see their own videos.
Exactly. But this is the great learning as well, is getting an opportunity to see yourself is very, very different. So that some of your body language, and I was just talking with John, I have a tendency to play with my pen. So for the student who's tapping their foot, playing with their pen, not making eye contact, this is when it is very apparent, when it obviously is not apparent to oneself, unless you have a chance to actually view your own performance. So it's not pleasant. However, students comment that this is one of the most meaningful learning opportunities. It's a safe environment, they can experiment, they can get it wrong, that's okay. And the real learning value here is discussing how it was effective, how it was less effective, and what can we learn from this? And what can I learn from you as my colleague as well?
This is going to be the last Joan and John show of this season. One thing before we leave that I would ask you to do is, as the skilled clinician rolls forward, to remember to observe and give feedback on the students' communication skills in other sessions. So if the student is doing a history of a system or an examination of that system, they should still be demonstrating good communication skills. And they need reinforced when they are by being told why they're doing that so well. And they may need encouragement to change if they're not doing it well. There will be some communication skills items on the assessments for each of the different blocks of the skilled clinician. Please fill them in and give appropriate feedback. And that includes in examination stations, where patients may not feel comfortable in some way in the examination. And often if the student actually uses the Fife process during the examination, they can find out what the patient's feeling and why the patient's uncomfortable, which may not be the obvious reason that you might think of. The patient may have other reasons to be uncomfortable during the examination, and the student may be able to reassure them appropriately. As I said, this is the end of our direct involvement for this year. We wish to thank you very much for being such excellent communication skills tutors, and we hope that you'll continue with that throughout the rest of the terms.
Yes, and I thank you as well. And my final comment would be that the communication skills that have been laid in the foundation of this unit are those that we're asking you to weave through continually in all of your teaching. And you are wonderful role models for your learners. So to also consider that what you share within your own practice can be very valuable as well. And that we ask you to consider always that there's a communication skills and patient-centered dimension to everything that we are attempting to help our learners teach or learn in this 1 year. So thank you very much, and good luck with term 2.